in this short video, we're going to talk about the application of an above elbow backslab. So an above elbow backslab we use when there is an injury to the elbow itself or to the forearm. These are usually unstable injuries where we apply an above elbow backslab. One thing to say, if there is an isolated radial head fracture that's not too displaced, or if all you're seeing is just a fat pad, you don't necessarily need to put them in an above elbow backslab. They can just be left in a broad arm sling. But certainly for the more unstable injuries, we go for an above elbow backslab. So first of all, we're going to measure. So we're measuring from the insertion of the deltoid, measuring up down to the electron, and we're going to go round, and again up to the south to the metacarpals, to the metacarpophalangeal joint. Okay, so once we've got this measurement, we then cut our plaster appropriately. So now that we've cut our plaster appropriately, we're going to apply the wool. So my assistant here is just going to hold the arm. Now normally what we do for the elbow, we tend to bend to just over 90 degrees, to about 100 degrees. Okay, and we're just going to hold the arm there. Now there are two ways of doing this. Normally, for most injuries, we tend to hold the arm in a functional position, so with the thumb pointing up. In certain injuries, particularly in unstable elbow injuries, sometimes we hold the arm in a prone position like this. Okay, that's rare. For the standard procedures, we'd hold the arm so that the thumb is pointing up. Okay, so like this. There we go. Now, again, we have our standard 15 centimeter wool. So we'll see that this causes a little bit of a problem when we're getting to the elbow, but there's a way of dealing with this. So we come along at 2 sheets. So as we said before, we just gently hold, gently pull, and then apply. Gently hold, gently pull, then apply. Gently hold, gently pull, then apply. When we get to the elbow by doing this, so we're going to be at about 100 degrees, we're trying not to leave too many folds inside the elbow. Okay, so we're holding at about 100 degrees, so then we hold. Now, particularly as we come over the electron, if we pull a little bit, it actually molds the wool itself. So it just, and then we come over, there we go. So there's a bit of area there where there's just a single ply, so what we do is we then just put a further bit of padding. Now the other thing that we do not have in our department is felt pads. Lots of people advocate the use of felt pads over the radial head, the lateral epicondyle, and also over the ulnar styloid. So we just have to be a little bit more careful and put a little bit extra padding for those areas. So with the wool on. So first of all, again we are limited with our 15 centimeter. This is an 8-ply slab. So what we do is we then get this. We're just again allowing the water to drip. We're not getting any of the plaster out. Okay. And then what we're doing is we are then applying this on here all the way. Now remember that the plaster sometimes shrinks. Okay. Sometimes we need to add a little bit further. So what we've got here. It's a little bit short, but that's all right. So almost an almond aspect. It's fine. Come across. It's nice. So you can see that it's holding the elbow, but there is very little lateral support. So for this, what we then do is we have bolstering strips. So these are 7.5 centimetre strips of plaster. Again, this is 4-ply or 6-ply you can use as well. So this we apply over the side. I'm just going to bring them up. There we go. So now if we look over here, we can see that this is also unsupported. Again, this. Clearly, if you've got somebody with a dislocated elbow that you've just reduced and you're trying to do this, it can be a bit difficult, but you need, as you can see here, that I could not do this without my assistant. So that supports the elbow, and it's now supporting the elbow laterally as well. So that's good. And then what we then do is we fold this. Not too tight, just beware. Particularly with some of the more complex elbow injuries, it's a high risk of compartment syndrome, so you don't want to have these too tight. Roll this back over. Okay. So over. So again, using a single sheet, just right. The elbow is now in neutral position in 90 degrees, the thumb pointing up. Okay, and this position, we can close the finger, we can close the little finger, we can make a fist. Okay, straight the fingers for me, and always after every plaster, we always do a quick pulmonary refill. We press 1, 2, 3, 4, 5. Okay, and it should be less than 2 seconds. There we go.